hello, Bay Area. Happy Saturday. You are listening to Radio Mirchi 1310 AM. This is RJ Mirchita. And today, as you can see, there's a different glow on my face. Isn't it? Laga chana? I knew it because I'm super excited and I'm thrilled because today's show is very special. And do you know why? Well, because we have today Dr. Modha, founder of Gokul Group of Hospitals, and along with him, we have the youngest and third practicing female neurosurgeon in the city of Mumbai and 15th in India. Imagine the youngest neurosurgeon, આપણી સાથે આવી ગયા છે Shraddha ma'am, and she is third in Mumbai and a 15th in India. Do you know the dedication and the hard work and all the things that she has done, worked so hard to reach at this level? I believe it's not an easy journey because even I've heard that ખાલી doctor બનવું ને એ પણ બહુ મોટું achievement છે. So you can imagine that, again I'll repeat, she's the youngest, third female neurosurgeon in the city of Mumbai and 15th in India. And today we will discuss about COVID-19, as you know, the hot topic, the hottest virus in the history of world, and blood clots, its effect on brain and vaccine. As you all know that how dangerous it is, right, to live in COVID-19 era. I feel like કાશ થોડું પહેલા જન્મી હોત અથવા તો આ પતી જાય પછી જન્મી હોત નહીં, પણ I can't change it. હવે જન્મ એ મારા હાથમાં છે નહીં અને મૃત્યુ પણ આપણા હાથમાં નથી. આ બે જ વસ્તુ છે ને ટેકનોલોજીથી કંટ્રોલ નથી થતી. જો ઇવન આઈ થિંક એ પણ ડોક્ટર સર્ચ કરી લે ને તો સારું કે તમે આર્ટિફિશિયલ હાર્ટ બેસાડી દો અથવા બ્રેઇન બેસાડી દો, તો બસ એ જ હવે જોઈએ છે લાઈફમાં. અને that's why we have amazing doctors with us and you never know, કદાચ ફ્યુચરમાં પોસિબલ પણ થાય and I am very hopeful. So today's topic, as we discussed, is about blood clots, its effect on brain, vaccine during COVID-19. But before I go there, તમને એવું થતું હશે નહીં કે આટલું ઇન્ટ્રોડક્શન તો આપી દીધું મેં બે લાઇનમાં, પણ એઝ યુ નો કે ઇટ્સ નોટ ઇનફ, રાઈટ? કોઈ પણ ડોક્ટરનું ઇન્ટ્રોડક્શન આ શોમાં આપવું, એઝ ઇન if I try to introduce a doctor on the show, I can probably write a book on them. I feel that way all the time because Dr. Modha brings amazing doctors on this show and literally I can write a book on her. But you know what, I've tried to trim down her introduction and I'll begin it. So Dr. Shraddha Maheshwari is again youngest, third practicing female neurosurgeon in city of Mumbai and 15th in the country, having done her MBBS from D.Y. Patil Medical College, Mumbai, MUHS University. She entered directly for her super specialization course, જેને આપણે કહીએ છીએ DNB, in the field of neurospinal surgery at the most famous hospital of Mumbai. Who doesn't know Lilavati Hospital and Research Center? Following her post-graduation, she was very passionate and she has done her fellowship in endoscopic, minimally invasive neuro and spinal surgery. મને minimally, if I say na, અગર મારે vegetable પણ કાપવું પડે છે ને, like if I try to cut a vegetable minimally, I almost get sweating, you know. અને એમાં પણ like we have doctors who try to do surgeries minimally, so hats off to them, you know. I can't even practice on a vegetable or a banana. It's just it's too difficult for me. So I just want to highlight how important her work is, because she has done this minimally invasive neuro and spinal surgery. And not just this, additionally, she has worked at various esteemed institutes like SAIT GS Medical College and Chem Hospital, Senior Registrar, TN Medical College and Nair Hospital as Assistant Professor, and LTMG Hospital and LTM Medical College as Assistant Professor. So not only this, but she is also a teacher. જ્યારે કોઈ ટીચર તમને શીખવાડે ને અથવા તો તમે ટીચર બનો ને, like when you become a teacher, you realize it's very difficult to teach. You can always, you know, learn, study and get good grades, but the most difficult part is becoming a teacher. So she has already nailed it. Not just this, in 2014, she pioneered the Department of Neuro and Spinal Surgery at the Dr. R. and Cooper Hospital, and Hindu Hridaya Samrat Balasaheb Thackeray Medical College, Mumbai. She is currently the founder and head of Department of Neurosurgery. I'll repeat again. She is currently the founder and head of Department of Neurosurgery of the same institution. It is the first super specialty department in a government-run hospital in southern region of Mumbai. She has developed and runs a comprehensive stroke unit with state-of-art cath lab machine dedicated to patients suffering from vascular problems of brain and spine at the BMC-run HBT Trauma Center at Jageshwari in Mumbai. I really feel that all the names I've taken, it has covered entire Mumbai, honestly. She has not even kept one single hospital out of her radar. It's like she has worked in every single excellent hospital in Mumbai. But not just this. She is the first lady in the country, at like in entire India, she's the first lady who is founder of a neurosurgery department. Having an experience of more than 11 years in the field of neurosurgery, she is also attached as visiting consultant at Surya Hospital, Nanavati Hospital, and Critical Hospital. I think, ma'am, I feel like I've indexed all the hospitals. So, not just this, but her special interests are in skull based surgery. Oh my god. Skull based, spinal surgery, endovascular neurosurgery, and even pediatric neurosurgery. Now, neurosurgery itself is very complex, right? My god. And in that, she has all this different special interest. Not just this. Hold on. अपनी सांसों को थम के रुकिए यार. ये तो कुछ भी नहीं है. She has performed more than 5,000 complex neurosurgical procedures so far. 11 years and 5,000 complex, okay, not just normal surgeries. I'm saying complex surgeries, and is among the first to perform the most complex Atlanta axial surgery from anterior approach in Mumbai, and second in the country. My god, that's amazing, incredible. And you all know that any passionate doctor, if has a lot of interest and lot of purpose that connects with research, right? Not just doing surgeries, but it interlocks with research. So she has over 27 publications in various national and international journals and has written 6 chapters in renowned international textbooks. Wow, being a teacher, this is what you do, right? And it's a part of your passion, I guess. She's also actively involved in various academic programs, organizing cadaver workshops, and has been invited as international faculty to train neurosurgery students in various programs in countries like Nepal, Bangladesh, Indonesia, and Korea. Excellent. Oh my god, not just in India but outside of India too. She's a global doctor, I guess. She's now actively involved in propagating women in neurosurgery. I want to repeat this in for loop. I work in tech. I want to keep repeating this over and over again because I really encourage women in tech. It's a challenge to even bring women in tech, and bringing women in neurosurgery must be extremely challenging because it's so rare to find females at this position. And she has been enlisted as top doctor in the field of pediatric neurosurgery in Mumbai for 3 consecutive times from 2019 onwards by India Today magazine and Outlook magazine. 3 times it means hat-trick, na, in the cricket. So ma'am has done hat-trick as a top doctor, right, Dr. Modha?
Yes, correct. Absolutely. We are proud of her.
Yes, exactly. And not just this, she has been listed in 40 under 40 2020, acclaimed by the prestigious Indian Achievers Club. At a very young age, you can see that she's listed under 40 under 40. She has also received Star Swasthaya Seva Ratna Saman 2021 by the prestigious Star Report Group. Well, ma'am is already a celebrity doctor, a global doctor, a passionate doctor who has an amazing purpose in life to bring women in neurosurgery. I think I can write an entire book on just her achievements. So now, without further ado, I am so much incredibly proud of having her on the show. But as our format goes, I would now invite Dr. Prakash Modha to say a few words about Dr. Shraddha and then give us a brief about statistics of COVID cases around the globe, India, US, Gujarat, Rajkot, and let's proceed with the next steps. So over to you, Dr. Prakash.
Yeah, thank you. Good morning, listener in India, and good evening, listeners in US and other countries. I will say only two lines about Shraddha. Shraddha is a dedicated, only third neurosurgeon, female neurosurgeon of Mumbai, and she is very dedicated for teaching of neurosurgery and bringing women or ladies, female in neurosurgery, and she is heading in our conference when we do. She is heading one special program for the female in neurosurgery. So she is the head lady to lead that program also. So we are proud of you, Shraddha, and I congratulate also. And let us start with the statistics now of COVID. Uh, Ishita, I will start with total cases in USA has come down drastically. It is 25,642 and
Yay.
death is 499. Very good. Then it is in Brazil also. Total cases are 69,300 and death is little bit high, 2,087. While in India, we also have a decreasing trend. It's 3 lakhs 10,822 total cases and death is 4,090. We come to Australia again. Yesterday I mentioned that Australia had 2 cases. Now today Australia had 10 cases. Only 10 cases in a big country like Australia and no death.
Wait,
So we
wait,
have to learn lesson from Australia.
but
Then
Dr.
we
Modha,
come to Gujarat.
let me pause you. Let me pause you. So you said there were
Yes,
two
yes, sir.
cases yesterday and now 10. So in one day it has increased to 8 more, right?
Yeah, 10.
Okay, okay.
Yeah, 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 yeah. But still it is the double figure only. And we
Yeah.
are crossing 5, 6 figures. So we are proud of Australia also. Now we'll
Hmm.
talk about the Gujarat.
Sure.
Total cases in Gujarat is also has come down 9,061 only and death is 95. So death has come under 2 figures only.
Mm-hmm.
So we are proud of that. Then Ahmedabad, it is 2,433 new cases. Surat, 304 new cases. Baroda, 1,034 new cases. And Rajkot, 476 new cases. I think it is a decreasing trend, and we pray God that it should remain decrease. And let us make our Gujarat, our India corona free, so that our people can survive and live better life. Thank you, Ishita. Thank you, and please over to both great lady.
First of all, thank you, Dr. Modha, for inviting Dr. Shraddha Maheshwari on the
Ishita,
show. Yes, yes. Uh,
now you can go ahead and yeah, you can continue with us,
yes,
Shraddha. Dr. Shraddha
yes.
Maheshwari, the great lady neurosurgeon of Mumbai, and we are proud of her because she is with us. Thank you.
Sure, sure. Thank you, Dr. Modha. So, first of all, very much thank you to Dr. Modha for bringing Dr. Shraddha on the show.
No voice.
Um, can you hear me, Dr. Shraddha?
Yes,
Am
I
I
can.
okay? Yeah, yeah, yeah. Yeah. So I think I'm audible, Dr. Moda. Maybe must be a network issue on your end. But I think so. Moving forward.
Yes, yes,
Okay,
yes, yes, yes. Yeah.
perfect. So moving forward, first of all, very much thank you to Dr. Moda for bringing Dr. Shraddha on the show. It's such a pleasure, such a thrilling experience because again, lady to
Carry on,
lady,
carry
right?
on.
I am the youngest RJ. She's the youngest neurosurgeon, so I can totally resonate and relate because it is very difficult to lead. It's not an easy journey. But first of all, I'd like to invite Dr. Shraddha to tell a few words about her journey, her story, a little bit. I have said a lot, so I want to know from her now. How does she feel coming on the show? And then we will start with the questions. So over to you, Dr. Shraddha.
Uh, thank you, RJ Mirchita. Thank you, Dr. Modha, for giving me this opportunity of being on this platform first and foremost. And I think any journey is a good mix of good and bad. If you don't have bad experiences, you don't learn from it, and if you don't have good experiences, you don't get motivated enough to go further and do something in your journey. So, of course, Dr. Modha is one of the persons who's motivated me positively. And, there are a lot like
Yeah,
him, my teachers, and everybody when I started neurosurgery who came into my life fortunately were very positive people, people very progressive people trying to push me to my limits to do things. And I think they were the ones who actually made me fall in love with neurosurgery on the first place. And I wasn't even sure when I had started with neurosurgery that whether I want to pursue this branch or no, because a lot of doctors at friends at home and family and a lot of people had said that this branch is not meant for women. Women don't take up neurosurgery, and that's why probably the statistically I'm the third female neurosurgeon in the city like Mumbai. So which came as a shock to me also, but thanks to people like Dr. Modha, Dr. Ramani, who are my teachers, and they've worked very hard on me, I must say, and pushed me to do what I am today. So that's there. And of course, there have been a lot of ups and downs. There have been a lot of negative experiences. There have been people who have been otherwise. And thank you to them also, because
Mm-hmm.
they make you learn. Yeah. And if you don't have them in your life, you have only good, then I don't think you appreciate the good that much. So, yeah, thanks to them also. So that's
yeah,
how
yeah,
my
yeah.
journey has been, and I hope to look forward to doing more great work ahead.
Thank you, Dr. Shraddha. So we'll start with a question, and I'd like to post the first question, which is what's known about COVID-19 and development of blood clots?
Okay, so to answer it very simply, um, if when you fall down, or even when you hit your, when you're walking and you hit your hand or your leg into something, you bump into something, what happens? What's the first thing that happens? After a few days, you notice a bluish blackish
Bluish.
discoloration.
Yes.
एंड बचपन से हमको बोलते हैं कि कुछ नहीं, खून क्लॉट हो गया है वहां पे, कुछ घबराने की जरूरत नहीं है, 6 हफ्ते में गल जाएगा, इट विल डिसअपियर, राइट?
Yes.
So that's what happens when you have any kind of injury. First reaction of the body is to send immense amount of blood over there to cause clotting over there. And exactly what is happening with COVID. Okay, so COVID, when it enters your blood vessels, and it injures the epithelium or the endothelium of the blood vessels, the reaction is normal. It's a natural human body reaction to react in this way to form clots.
Mm-hmm.
Unfortunately, in COVID, what is happening is the clot formation is in a little bit of an excess quantity, and if it is not controlled in time, it can go to other organs and cause problems. Second problem with COVID patients happens is that patients are bedridden, right? So when they are bedridden patients, uh, the movement is less, the blood circulation or stagnation is more higher in them, and that is why when these blood clots develop, they're not circulated properly, or the blood does not reach them properly. So they tend to become more intense, causing problems like if it happens in your fingers or toes, it can cause gangrene or bluish blackish discoloration of the
Mm-hmm.
limbs. So that's medically termed as gangrene. If it happens in your lung, it can cause pulmonary embolism.
Mm-hmm.
If it goes into your heart, it can cause a myocardial infarction or a heart attack. And if it goes into your brain, it will give rise to a stroke, because the blood supply in the brain is affected. So, all of this fall in the spectrum of COVID 19, especially seen in cases which are admitted in the hospital, or who have a lot of comorbid conditions beforehand, before they have contracted COVID. So, yeah, clotting is an immense part of COVID 19, and that's how the blood clots develop in COVID 19, and these are the problems that they can cause.
Thank you, Dr. Shraddha. Um, we'll move to the next question. But before that, I want to let you guys know, people who are watching us live, you can comment your questions and we will try to answer it live. So please comment your question, but we'll move to the next question. Thank you, Dr. Moda. The next question is, how can this blood clotting affect the brain?
Okay, the blood clotting in the brain, as we say that when a clot enters into a blood vessel, okay, it causes blockage of that blood vessel, and then it decreases. Obviously, there is no flow of blood beyond that point. So, जब there is no blood supply beyond this point, of course, the tissue lacks oxygenation, and because of that, the damage occurs. COVID itself also causes an additional problem, that the oxygen levels are already compromised in these patients. So, with an already compromised oxygen level, plus the oxygen supply or the blood supply to an organ like brain, when it gets hampered, it gives rise to what we call as stroke, and these are more rapidly progressive strokes compared to the normal thing that we see, because there is an additional factor to this. Now, there are different ways or different types in which stroke can occur, and in COVID also it is no different. So I think we have a small video on the types of stroke, and I think we can just play that so that the people can understand it in a better way.
Is this the video, Dr.
No, the
Shraddha?
second one.
Second one.
The
Okay,
second.
I'll put this one. Give
Okay.
me a second.
So
I'll just play from the start, right?
yeah.
And I'll remove this question so people can watch. Okay, is this? Can you see my screen? Is it visible?
Yes. Yes.
Okay, so I'll play this video. Okay, yeah, I'm playing it, ma'am.
So stroke anyways is a leading cause of death and disability world over, and in India also. But in COVID 19, we've seen more numbers now coming in. As we spoke earlier, it is because of a blockage of the blood vessel, or the second type of stroke can occur because of rupture in that blood vessel when the pressure builds in. So, when there is no blood supply, the brain tissue is damaged, and there is no functional, or the functionality is lost. And three main types that can occur are, first is the ischemic, where the arteries are narrowed or blocked by a clot. And this is the most common type of stroke that we see. And further ahead, there is no blood supply that happens. In this also, there can be, small episodes which only last for a short period of time, when your body immunity is good enough to take care of the clot, and it pushes away the clot on its own. These are called as mini strokes or transient ischemic attacks, which last for a short time. The second type of stroke that we spoke about is hemorrhagic stroke, when the blood vessels in the brain, when the blood pressure rises or there is a blockage, suddenly there can be a burst of blood vessels that are there inside the brain, and can
Mm-hmm.
cause bleeding and clotting inside the brain. This is called as hemorrhagic stroke. The treatment of the two is different. Uh, this is a small thing that we ask all the patients, to take when they're having a stroke, to look at the which we call as FAST. F is for facial drooping. You can see something like that. The patient's face is, paralyzed on one side. Usually, there is A is for arm weakness. So they have inability to lift up their arms and function properly. That is A. S is for speech difficulty. So, when you have speech difficulty, there is a slurring of speech, or it can be inability to understand words or speak clearly. It can be any manifestation of speech that can occur. That is speech. And T is, of course, time. So, when you see these symptoms, it is time to rush to the hospital, because in stroke is time. We have no time to lose when a organ like brain is affected. Other symptoms that are a little uncommon are blurred vision or double vision. Temporary blindness can occur. These are also signs of stroke. There can be numbness or heaviness in the arms or limbs,
Mm-hmm.
on especially on one side of the body. These are the starting signs of stroke. Headache is very commonly accompanied. Sometimes there might be vomiting, especially when there is hemorrhagic stroke or bleeding inside the brain. So, when you have these kind of symptoms, be alert and take care, so that stroke can be recognized as early as possible, and can be rushed into a hospital.
Sure, ma'am. Thank you. Dr. Modha, any comments? Dr. Modha?
Dangerous disease, and one should report immediately to the hospital. Within, if you reach 6 hours, we can retrieve the clot. Endovascular treatment, give endovascular treatment, bring the clots out from the artery, and that is Shraddha is expert in it. So she will tell us more about the further management of the stroke.
Sure, sure, Dr. Modha. So we have a listener who is asking a question. So we'll
Yes,
take
Shraddha,
that
can you listen me?
Yes, yes.
a little bit distortion, Dr. Modha.
Yeah, take it, no problem.
Okay. So we have a question from Ramesh Waza, who is watching us live,
Huh?
and he's
I'm not seeing any
asking,
questions.
yeah, yeah. Can you see it now? The question is, what type of food to take after recovered from COVID to increase
Yeah.
immunity?
No, no.
Yeah,
You speak,
yeah,
I will
sure.
answer, or Shraddha will answer.
Um, Dr. Shraddha, you wanna
Shraddha,
take
Yeah.
it?
Okay. See, COVID,
you can take the
there
question.
are no special foods, or there is nothing specific, but as we always say and recommend, even in normal life, a healthy, balanced diet is good for your immunity. And that is something that these patients must look at even after they have recovered from COVID. One thing that we advise these patients is to keep themselves well hydrated. The vitamin intake, especially of vitamin D and vitamin C, which is a little lesser in our foods, and B12, which is not freely available in the food, can be supplemented in these patients. And maintain a routine, have a moderate level of exercise, starting from very low exercises, going to moderate levels. Don't try to rush into running and things like that, but some form of exercising, even yoga, is good to boost up your immunity when you've recovered from COVID. But having said that, some people are having prolonged problems with breathing and oxygenation levels, so that monitoring is needed. So yes, essentially it's any balanced diet, especially Indian diet is it's always balanced, and we've had a good mix of proteins, vegetables, carbohydrates, everything is there, fats also. So all of that is good for our body, and we must focus on having a good diet. That's important.
Thank you, Dr. Shraddha. Dr. Modha, can you hear us? Are you audible? I see some network.
I want to add is good high protein diet with plenty of green vegetables, and as Shraddha mentioned that our Indian food is already balanced diet. But to recover and get immunity thread, good exercise, good yoga. That is what we are supposed to do.
Excellent, excellent, doctors. Thank you for the answer. So, Ramesh, I hope we are able to
Agreed?
answer you. And there's one,
Can you listen, Shraddha?
yes,
Mirchita, can you listen me?
Yeah.
little distorted, but now we can hear you. Maybe you want to disconnect your the earpods. Maybe
Yeah.
that would be little better then. Um. So hope Ramesh, we have answered your question, and there is one more. I can't say
Let
patient,
us
but
go
one more
ahead with the
person. Yeah.
Shraddha. Next
Yes.
question. Please
Yes,
answer the
sir.
other question.
So we have a question from Jayesh Thanki, and he's asking, when patient is asymptomatic and gets a stroke, how do you treat?
Okay, so quintessentially, I think that was our next question also.
Yes.
That probably you would want to ask after knowing what are the types of
Type of
stroke.
stroke. Yes. Let
Uh,
me take
yeah,
that.
so like Dr. Modha added earlier on also, if stroke is reaches in time in the hospital, especially within the first 8 hours of stroke, what we called as the golden period, a stroke can be recovered, it can be treated. Now, what we do in these patients, especially who
Yeah.
reach us within the first 8 hours and sometimes 24 hours, depending upon what we see on their MRI,
Mm-hmm.
we try to retrieve the clot out of their brain. So I think we have a small video on that also, the third
Yes.
video that is there. So the procedure essentially is called as mechanical thrombectomy, which is where the catheters are passed into your brain blood vessel. As you can see here, this is a blocked blood vessel. The dark red color is the clot. A stent or mechanical device is pushed inside to engage the clot and bring it out of your blood vessel into a specially made device to restore the blood supply inside the brain. So this is exactly what we do in a mechanical thrombectomy, where we pull out the clot with the help of this device and
Mm-hmm.
try to restore the blood flow to the blocked area of the brain. Now, in this procedure, of course, everything cannot be salvaged. Some area of the brain is lost, but the secondary damage that is not yet occurred is avoided, and most of the patients have a good functional recovery if they reach in time to the hospital. So that's why we always, when there is a stroke case, we always tell to the patient, and the dictum has always been stroke is time, because if it is identified and managed in time, it can be a game changer for the patient and his family members. Imagine
Yes.
having completely paralyzed person at home, and to bringing somebody back home who can actually be functional, do his own things with minor deficits or little deficits. So there is a vast difference in the recovery that we see in these patients. Gone are the days when we used to say that stroke is not treatable. It is no longer like that. Stroke has a treatment, and hence it is important. Earlier on, heart attacks or myocardial infarctions, I'm sure when they started, people always thought कि इसमें तो कुछ इलाज ही नहीं है.
Yes.
Stroke का still the awareness is very less, and people think कि if it is paralysis, what can one do about
One.
paralysis?
Yes.
That's a basic attitude, or people don't come to the hospital only
Mhm.
because they think any which ways कोई treatment तो है नहीं, hospital में admit करेंगे, खर्चा करेंगे, and all of those kind of things,
Correct.
until and unless the patient starts becoming a little bit unconscious or something of that time, which is a very delayed phase to bring the patient into the
To the
hospital.
hospital.
So, this whole thought process that exists in the general public, that stroke is not treatable. No, of course, stroke is treatable now with newer medicines, with newer surgical advances. And mind you, this procedure is incision less
Oh.
because it is only through the catheters. It's
Mm-hmm.
a very minute catheter that we put inside through through a needle which is passed into your thigh. It's like, an injection which is put into your thigh, a
Mm-hmm.
cannula. And like how we give saline, that kind of a thing, we and then from there we pass in these catheters. So it is a completely closed procedure. There are no major incisions on the skull or anywhere of that sort. And like I said, if it works for the patient in good time, it gives magical results.
So I'm
So
just
that yeah.
sure, Dr. Shraddha. I'm just playing this video one last time so that people can see, right? I don't know. A lot of people would even understand or know this, but glad we are
Yeah.
able to share this today. Dr. Modha, any comments? Dr. Modha?
Yeah, this is the best way. And I've seen we are doing these procedures, Shraddha, in our second hospital. And
Yes, I
almost we have done 20 cases of MCA infarct. And out of 20, almost 80 has recovered completely. They go hospital giving procedure. And only thing is the price, cost. It cost in Rajkot around 3.5 lakhs. So, how much costing it
Oh.
in Mumbai in the municipal hospital? Shraddha.
see, in municipal hospitals, actually, the device and the companies that provide this material, the material is expensive. So, the treatment of these patients in municipal hospitals or at our center is almost zero because the patient care admission procedures, we don't charge anything to the patient. Also, there are certain schemes, especially with the Pradhan Mantri Yojana coming into the picture. A lot of it is covered under it.
Mm-hmm.
For catheter,
Probably the patient has to shell out something like between 1.5 to 2.5 lakhs from his own pocket if there is a shortfall of funds that are approved for him. So,
Excellent.
yeah.
So a lot of people watching us may not
yeah,
know that the Pradhan Mantri Yojana, there
yeah,
is a
very good,
Pradhan
very good.
Mantri Yojana that covers the cost. So I think the doctors. I don't know how you guys educate people about all this, but I just want to highlight that I'm actually not aware with what's happening in India because I'm in San Jose. But maybe we will bring some socialized doctor who can then just let people know about what is this yojana and all. But in respect to the time, we'll move to the next question, which is how can we detect stroke at home?
Okay, so I think again, there's one video, a very interesting video, the first one,
Mm-hmm.
which most of the people, at least the Bollywood fans, must have seen this movie. This is seen from the movie Oh My God, and some brilliant piece of acting by Mr. Paresh Rawal. This is the court scene
Mm-hmm.
where you can see now he is talking over here. Now, suddenly you will see that a right handed person is using his left hand and his right
Mm-hmm.
hand is still. Can you see that? There's no movement in the right hand.
Mm-hmm.
And then he starts slurring in the speech. He is not able to speak clearly. And after that, there is a blackout or an episode where he cannot see clearly. And then he falls unconscious. Also, you can see that there is, the facial weakness that happens. So, I think this is a classic way how a stroke presents. And because it is a movie, I think it's the best way for people to remember that when somebody is having symptoms like this is a stroke. This is a
Mm-hmm.
classical stroke presentation, and this is when you need to act fast. So,
Hmm.
as we say, act fast, face, arm, speech, and time. So,
Hmm.
this video I think highlights that, and I always like to show this video to general public whenever I'm talking about stroke, because I think it stays with them and it helps them to identify that this is how stroke looks at home. So when you have a person like this at home or in any public place, you see these symptoms, identify it as stroke, and rush the patient to the hospital.
Um, sure, Dr. Shraddha. I think we covered how can stroke be treated in the previous questions. I would skip
Yeah.
that, but the next question I'm gonna take with both of you is: should the risk of infection prevent patients from seeking timely treatment in stroke?
Okay. So, because of the COVID-19 picture coming in, and because of the lack of awareness about stroke in general, people are not reaching to the hospital when they have stroke. They try to do video consults. They want to be at home and see to it that if we can just treat it with medications at home, and they don't reach hospitals when they are having a stroke. And
Hmm.
especially, because of this COVID thing that is going around. Now, in patients who don't have COVID and have a stroke,
Hmm.
it is important for them, like we have been repeating again and again in this whole show, that stroke is time. So
Hmm.
seeking timely treatment for stroke is essential, and that is the only way available to you to get out of a situation which can last with you for a lifetime. So I don't think there are a lot of hospitals who are doing stroke treatment amidst the COVID pandemic also. And if the patient has to seek treatment for stroke, it should be in a timely fashion, because beyond a certain point of time, like I said, it is there's nothing that we can offer really to the patient. There's not much that we can do about the paralysis that has already occurred. So if we have to recover with that, reach to the hospital in time. And most of the hospitals are taking the precautions of COVID-19, and trying to keep you safe from it. So don't worry about the infection. Walk into a hospital, and whatever treatments need to be done in time need to be done. We don't know the kind of losses that we are having in this pandemic, because a lot of patients are just not going to the hospital for the fear of infection. So other lives, other diseases, people with other problems are not getting treatment from their own fear.
Mm-hmm.
But that's not the way to go about it. COVID is one infection. Of course, it is a big thing right now. And with the second wave, there is a lot that we are doing about COVID. But that doesn't mean that we are neglecting onto the other diseases that are happening in the country. So don't feel scared about the infection. Go to the hospital in time.
Excellent, Dr. Shraddha. Dr. Moda, any comments or on this?
Correct. Absolutely. Yes, yes, this is excellent. Excellent. Patient should reach in time. That is very important message. That 6 to 8 hours, patient must be reaching to the hospital that is
Hospital.
from the stroke.
Excellent, sir. So, um, um, the next question, which we have one question that I have to take this question because it's coming from our listener live, right? People who are watching us. And Jayesh Thanki has posted a question that has fluctuating blood pressure anything to do with the stroke?
Yes, so certain diseases have been associated with stroke, and the patients who suffer from certain diseases are at a high risk of getting a stroke, both in a non-COVID situation and a COVID situation, both. So, hypertension is one of them. So, if you have uncontrolled hypertension or a fluctuating BP, you are always at a high risk, because it is directly related to your blood vessels. So,
Mm-hmm.
you are at a high risk of developing a stroke. If you have uncontrolled diabetes, these patients are also prone to developing clots and having a stroke. and smoking. These three things
Mm.
have been, clearly shown to be related to stroke. And yes, if you have any of these things, you must take good care and treatment about them, and try to keep yourself safe from other problems coming in your way.
Thank you, Dr. Shraddha. Jayesh, I hope we have answered your question. And the next question is, speaking about blood clots, lot of reports about vaccine causing clots are coming up. How far do people need to worry about it? It seems a very interesting question.
Okay. So I know there are a lot of reports which have come out, which have been speaking that if you take the vaccine, you'll develop some kind of a stroke or a blood clot or a myocardial infarction, and that there is going to be a problem ahead, which is dissuading people not to take the vaccine. So they don't want to go ahead with the vaccination because they are fearing about this blood clot. But if you ask any medical personnel or a doctor who's actively involved with the COVID-19, all of us are involved in it right now. So
Mm-hmm.
most of the doctors will tell you otherwise. The chances of you getting infected with COVID-19 itself and having clots from COVID-19 are much, much higher than you getting vaccinated and getting, blood clot. It's
Mm-hmm.
like, if I have to put it in a very layman language, I think, there are more chances of you getting struck by a lightning and, having a problem than, having blood clots after taking a vaccine. So that's how it is. We are not denying the fact that there are a few reports, there are a few cases which where we have seen patients have taken vaccine and developed these blood clots. But labeling the vaccine as the cause of it is not really true. We are still trying to find out whether it is the vaccine or some other problem. But the numbers are so less. Like I said, there are more chances of you getting struck by a lightning than having blood clots. So I think that really clears out what the vaccine does to your body. And of course, the positive effects of the vaccine, we are seeing that in the second wave. And after that, the drive everywhere is, been to push people to get vaccinated, especially in India with such a huge population. We are struggling with it, but yes, we are getting there. So don't worry about the blood clots. If you're getting the vaccine, please go ahead and take your shot.
All right. So I think next questions we are taking are on vaccinations, which are, have you been vaccinated and what's your experience?
Yes, of course, because most people, I think, first when they're listening about any talk about vaccine, they want to know whether the doctor herself or himself has been vaccinated or no. So yes, I have taken my vaccine. I have taken the AstraZeneca and the Serum Institute's Covishield vaccine.
Mm-hmm.
I've taken it in January, and I'm still hale and hearty and alive in front of all of you all. So both my doses, both my shots have been complete. The government of India is running a great drive, and everything is online. It is perfectly as put across to you. Walk into a center. Within less than 45 minutes, you are out after taking your vaccine and observation and all of that.
Mm-hmm.
Uh, Most people have certain side effects. I had side effects of the vaccine on the first day,
Mm-hmm.
which were as normal as you get with any other vaccine or a shot that you take. So I
Mm-hmm.
had little chills or shivering in the night,
Uh-huh.
and body ache and very mild fever, which
Hmm.
lasted for 24 hours. And after that, I was absolutely perfect without any issues. So the vaccine experience is not bad at all. There are a lot of people who want to take prophylactic crocin before stepping out, or a paracetamol before taking the vaccine. So don't do that. A lot of people don't develop any symptoms or side effects after taking the shot. So wait for your body to react to the vaccine. If you're having, then simple treatment like a crocin or a paracetamol is enough to cover your disease. And of course, another thing is keep yourself well hydrated after you've taken the vaccine shot. So yes, get vaccinated. It's important.
Thank you, Dr. Shraddha. Dr. Modha, do you want to share your vaccine experience or any comments? Um, Dr. Modha, can you hear us? Hello?
Yes, yes.
Okay. All right. So you are there. Do you want to share your experience on vaccinations or
Hello,
your
Ishita.
vaccine experience? Yes,
Can you hear
yes,
me?
yes,
Okay, okay.
yes.
Yes, yes.
Do, do you want to say a few words on the vaccine experience?
Yeah, yeah. Good answer. Yeah, yeah. Even I have taken vaccines, and as Shraddha mentioned that I had a mild headache and little body ache, but otherwise, apart from that, there was no problem. And my whole family had taken vaccine, and none of had a problem, none of had a reaction. So be bold, go for vaccination. We'll be having a good protection against COVID.
Thanks, Dr. Modha. So I think
So one
there's
must go for the
Mhm.
vaccination.
Whoever is watching us live, guys, one request from all the doctors is please go and have your vaccination done because
Any
that
other
is going to save
questions?
you. No questions so far. The next question is we're going to take is vaccinations in women, especially during periods, pregnancy, and lactation, remains a confusing. It's very confusing whether I should take it or not. If I'm a pregnant woman going through all of it, so what is your advice, or can you clarify it?
Okay, first thing is periods and the vaccination. Um, I don't know about USA, but in India there was some news or videos which said that the immunity of a woman is very low when she is having her periods, and that's why women should not take their vaccine when they have their periods, or
Mm-hmm.
they should not. It's not recommended to take vaccine during your periods. So
Mm-hmm.
let me be very clear on this thing that your immunity and periods have nothing to do with each other. So it's a natural phenomena that your body does every month, and it's not at all recommended that you should stall your vaccine or your vaccine dose just because you've got your period. So even when you are menstruating, you have your period and it's your date to take the vaccine, go ahead and take the shot. It does not
Mm-hmm.
cause any problems or it's not related to each other at all. The second thing is pregnancy or people who are planning to get pregnant. Let me first talk about them. So, if
Mm-hmm.
you're planning to get pregnant, especially in India, it is recommended that you finish off with your vaccine doses. Wait
Mm-hmm.
for at least 2 weeks after your second shot, and
Mm-hmm.
only once your second shot, you've completed 2 weeks after your second shot, try to plan your pregnancy after that only, because even during your pregnancy it will be of great help if you are already vaccinated and you have the immunity. It will protect you, both you as well as your baby. The third is the pregnant category, or people or women who are already pregnant and are into pregnancy. So world over, I think in US and UK both, they have declared the vaccine. They have declared the vaccine absolutely safe for pregnant women, and they are giving shots to the pregnant women as well. However, in India, we are still awaiting. We are still waiting for an approval from the government of India to sort of allow us to give vaccines to pregnant women, since
Mm-hmm.
we don't have any guidelines laid down for them so far, and we have not been permitted to give vaccine to a pregnant or a lactating mother.
Mm-hmm.
That's why if you've not planned your pregnancy, please take your vaccines and then plan your pregnancy. But if you are pregnant, at least in India, we are not yet allowed. Although the doctors are trying to get an approval so that we can vaccinate pregnant women as well as lactating women. To take the vaccine and so that it can protect both the baby as well as the mother. So, but yeah, as of now, pregnant and lactating women in India are prohibited from taking vaccine, especially in India, yeah, in our country.
Right. It's quite a shock for me to know this. I was pretty shocked when I got to know that, pregnant and lactating mothers are not like permitted to get the vaccine. One shocking
Yeah,
news
because
for me.
we don't have any studies so far, telling us about the safety of vaccines in these patients.
Mm-hmm.
I think the government is waiting for those studies to come across, especially in pregnant and lactating mothers, and only then they will give us the permission to do that. And I think that's the right way to do it.
Thoughtful process. I think India is now becoming digitalized and very thoughtful about what they are doing, even from government side. I feel that way personally. What do you guys think?
Yes, of course, of course. I think this whole COVID, last 2 years, the COVID wave itself, and then the vaccination drive that the government has planned and implemented. I think there is a lot of thought process, there is a lot of thinking, there is a lot of expert opinion, everything put together. They're not just it's not just a bureaucratic approach, or it's not just a political agenda for them. They are really trying to help out people, and I think we, especially people like me who are working in government centers, and
Mm-hmm.
we know the inside of how things have been planned and how much pain and efforts each and every government official is taking to take care of COVID-19. I think it's a commendable job done by the government of India and the
Mm-hmm.
government of each and every state.
Excellent, Dr. Shraddha. We have one more question from Jayesh Thanki, and he's asking, how do you attend trauma due to injury during COVID pandemic time?
So essentially, for us, nothing changes as far as attending trauma patients is concerned. The only thing that changes is we wearing a PPE kit.
Hmm.
So there is nothing. If I said, if it's an emergency, yes, our major focus is on COVID and its treatment, patients, taking care of the wave and the pandemic. But that does not mean that we are neglecting other emergency services or patients who are coming in with head injuries and things like that.
Mm-hmm.
We have to protect ourselves, our staff, the hospital people when we have such emergencies. So we are taking proper precautions for ourselves. And but it is not that these patients are not attended. It's the same. If they need a surgery, we offer the surgery also. My own department has already, from the last wave to this wave, I think must have operated upon at least 200
Wow.
head injury cases, whether COVID, in the COVID, and most of them turned out to be COVID positive, because in emergency hours we don't have the report with us. But yeah, we've been taking the vaccine. I have operated on many such patients. I got infected from one of such patients and contracted COVID. So it's not that the doctors are not taking care of emergency services, or are not attending to a COVID positive patients, who have emergency situations. So we are doing the surgeries, we are offering them surgeries. So don't worry about it. If you have a problem, go to the hospital. It might take a little time. It might be not as pleasant as it used to be earlier. But understand the fact that the doctors are overworked, but you will be definitely attended.
Dr. Modha, any comments?
Yes, we have treated more than 500 trauma cases during this COVID time at both our hospitals. And fortunately or unfortunately, we have a doctors who has got COVID. They were
Oh,
COVID positive. So we don't mind attending any uh, trauma, and we have saved so many lives, you know. So that is the thing. And we are still working. Our doctors are working day and night. They attend trauma, they attend stroke, they do spine surgery, and lots of surgery. We are just doing it during this time, and there is no problem. None of our patients suffered or infected with the COVID, who was COVID negative.
I think the doctors have
But our
made such
doctors
a
become COVID positive.
COVID positive. Yeah, yeah.
Yeah,
Then I remember in the past COVID awareness programs, you mentioned that the doctors have to be quarantined then for 14 days and they cannot work. Oh, that
yeah,
experience must be
yeah, yeah.
painful.
So, yeah, yeah. And
So
fortunately, we
actually
have
speaking,
got a team of doctors so that speak,
so
Shraddha, you
actually,
speak.
I'll talk little about my experience of the 14 days quarantine that I had.
Mm-hmm,
Uh, I think I was I had mild symptoms. I had fever, headache, body ache, and all of those things. But I think those were the most beautiful 14 days that I saw. Amidst the pandemic, where everywhere there was negativity.
uh-huh,
Because when I contracted COVID. My hospital staff and people they sent next day itself they sent me a huge box of goodies and medicines and the works so that I could take care of myself and the immunity. It was a very beautiful gesture from them. A lot of friends and family people they sent you take this kadha to boost your immunity. You so you know Being on the other side of the thing and as a patient, I think it was a very overwhelming experience of being quarantined, and there was not a single day left where I wouldn't receive phone calls from my patients, friends, and family to ask how I was doing.
mm-hmm,
So much love and affection. I think it was a very overwhelming experience, and this happened during the first wave of COVID.
uh-huh.
And I'm sorry, I'm very little emotional right now. But
Oh,
when I finished 14 days of my quarantine, I was all fine, and I went down to go back to work. The security guard of my building said to me that he actually stopped me at the gate, and he inquired about how I was feeling. And can you hear me? Hello?
yes, yes.
Hello?
We can hear you. We can hear. I just put you on the highlight. Yeah, yeah. We can hear you.
Okay. So, the security guard, he stopped me on my way to the hospital, and he told me that how did you manage to get COVID? And I was like, I had operated upon this patient who turned out to be COVID positive, and maybe that's where I contracted this infection from. And he was so overwhelmed and made me feel so overwhelmed by his next thing that he told to me. He said, Madam, yours was the only car that left the building every day. And we felt so proud of you when you went to work every day. And please take care of yourself when you're dealing with these patients. We really need you at this time. So I think it
Oh,
is one of the most overwhelming experiences of my life, and I think it just makes you feel so good and so proud about the work that you're doing. And yeah, that's what my experience was, and I think it was definitely a welcome experience.
yes. It
Yeah,
does
yeah,
make you emotional. So
Sorry.
yeah.
I
But
completely understand
uh,
your feeling.
now you see, yeah, we agree with you. And being a neurosurgeon, it's very hard to stay away from the hospital work because we get bored.
Yes.
You see, I'm here at my home. I'm not going to hospital since last 2 months. So I get bored. That's why I started. You see, that's why I started the things, and that's why at least we are able to help patients and people
Patients.
from Gujarat and all over the world.
Yeah.
Yeah. So that is what
So.
our experience is. Actually, for me, our staff and our neurosurgeons were very much affected to me, and they are very much attached to me. So they said, "You stay at
Mm-hmm.
home, don't come to the hospital. We'll manage the show." So there are four neurosurgeons who all are managing two hospitals in Rajkot and one hospital in Jamnagar. But all are happy because they all had a COVID. So they don't worry. But I didn't have a COVID. So they worried about me. So that's that I should not get infected. That is the reason. And I got that is why I am at my home.
Yeah, exactly.
So
A lot of positive emotions coming in for us, and it motivates us to do more. I think it's a different feeling altogether. For people like us who've been working for so
yeah,
many
yeah.
years in medicine, to see these emotions come from the other side. Generally, we are the care providers, so we give the patient this kind of comfort. But something like this coming from the other side is
Yeah.
priceless, I will say.
Yes, yes. I
Yes,
want to
yes.
highlight that doctors got emotional today on the show. This is the first time where doctors are really speaking out their heart, right? If any cardiologist is watching us, I think if he would put
Yeah.
like an angiography on your heart, then probably we would know how many emotions would just pop out today, right? So, oh man, I
Yeah.
should invite Dr.
So anyway,
Bharti.
we enjoyed the talk.
Yes, we
Yeah.
enjoyed the talk very much, Dr. Shraddha and Dr. Modha. I have one last question for both of you, which is any final message you want to give to everybody in the testing times, and we would wrap up the show.
Um, for
Being a
me,
lady.
the yeah. So for me, the final thing that I would want to tell across to everybody is that please be positive.
Mm-hmm.
There is a lot of negativity floating around with this COVID pandemic coming into the picture
Mm-hmm.
around us. At least when you come across a patient who's your family, friend, relative, who's suffering from COVID-19, I would say just when you're communicating with them, please communicate positively.
Mm-hmm.
Simple things like rather than calling and asking them, how did this happen to you? And letting them relive the whole story, just ask them how are you doing, and how things are with you, rather than scaring them about hospitals and telling them, oh, hospitals are so horrible nowadays and the situation is so bad. Try to tell them that hospitals, I don't think you would need the hospital at all, because more than 80% of the cases are getting better at home itself. So be positive, and let's look forward to it. And things like these, which are more on a positive note, rather than trying to criticize the system or trying and narrating a story, a negative story about somebody who lost a relative or a family member to this COVID pandemic. Try to be positive and empathetic towards them, and
Mm-hmm.
try to spread good vibes around you. So that's the least that you can do when you are, because you cannot be physically there to take care of the patient. So talk to them positively, keep up their mood, keep up a good vibe around them, and make them feel good. That's what I would want to say.
Thank you, Dr. Shraddha. I just want to share one last thing
Yeah.
that
I will
the
say,
reason. Yeah, sure, Dr. Modha. Go ahead. Go ahead,
yeah,
Dr. Modha.
I will say, do yoga, be positive, have a good food, good vitamins, exercise, and be positive. You will be positive always, and COVID will go away from you.
Sure, Dr.
That is
Modha.
what I feel.
excellent advice from both our doctors. And since Dr. Shraddha got emotional, I've not said this, that why I started the show, right? But one day I just called randomly to Dr. Modha and I'm like, I want to do something in this COVID. And he's like, what do you want to do? And I'm like, I want to start this COVID awareness because people don't know anything on precautions. I mean, CDC changes the guidelines, local news changes their guidelines. There is no source of truth. So we decided that we will bring each and every doctor on the show and let's start this, because my parents got infected by COVID in India, even though they had taken vaccination. And it was so miserable for me in United States, sitting here doing nothing and just let it watch, which was like painful. I wanted to do something, and there was this park, and then Dr. Modha is like, beta, let's do it. So his energy, passion, and his dedication towards this show is just incredible. I again want to thank him for supporting me on this, and being so young. Yes, Dr. Modha.
Tomorrow
Yes.
we'll have one Ayurvedic doctor,
Okay.
Dr. Bhavna. She
Uh-huh.
will say what she will talk. She will talk about the patient who is getting post-COVID weakness, uh, lethargy, not feeling well. So she said she will make them better by her uh, exercise, by her good food and good thoughts. So similarly what Shraddha said, the doctor coming tomorrow will be elaborating us in detail about post-COVID weakness and post-COVID syndrome people are facing. So tomorrow we'll have another good day. I hope we all have enjoyed, and
Yes.
good luck to Ishita, and thank you, Shraddha. We'll interrupt you and we'll bring you sometimes again. So be ready with another subject related to COVID or neurosurgery.
Yes.
We will do it.
Yes,
Okay?
we will.
Thank you.
Thank
Good
you.
day.
Thank you,
And good
Thank you
night
so
to
everyone.
much.
Ishita. Okay.
Thank you. Thank you so much, doctors.
Okay.
Really appreciate it. We will see you
Thank you.
soon.
Okay.
Bye. Bye.